It's a really important question, and so they posed me the task of talking about, are we there yet? And I guess the conclusion is more or less, but not quite. And so up to now we've been doing risk stratified studies using tools like FISH, then gene expression profiling, then subsequently more finding the DNA drivers of the disease. And the premise has been, if you could find a DNA driver, you can target it therapeutically. And that clearly works with targeting BRAF or the RAS pathway, but the trouble is everybody relapses really quite quickly. And so we look through our data, and it's about the way the cancer's structured, and not all of the cells contain those abnormalities in RAS mutations, say, and so only a proportion of the tumour cells will respond. And so that's a bit like Darwinian style evolution and cancer evolutionary trees. And so I guess what we learned from this is, if you target the root of the tree, you're going to do better if you target a branch. And so some mutations like the 1114 can be targeted with drugs like Venetoclax. And so Venetoclax really looks interesting in the 1114 subtype, where it targets the pathology of the disease directly. And so I think we are going to move to these more targeted strategies in the next year and a half. I think this will really start to be important in myeloma therapy.